Opioid use disorder or addiction is one of the most feared complications of opioid-related problems. The condition is estimated to develop in somewhere between 9 to 20% of people that are prescribed opioids, and is much more common in people that use them illicitly or purchase them off the street. The condition is a brain disorder. It's a disease, and the good news is that it's treatable, but it's important to understand what's going on in the brain as it develops. Early on in use, people use the drug for pleasure, and what happens is over time they start lacking control over the behaviors. A deep center of the brain that's primarily responsible for pleasurable responses to normal everyday activities, such as those you experience when you eat ice cream or you pet your dog, goes up in profound ways when you use opioids. Opioids can lead to what's called euphoria, and that's that dopamine surge in the brain, a hormone that lets you feel pleasure. Initial use is really driven by feeling that sensation, and it can drive people to have early symptoms of the disorder. Things like using opioids more frequently than they should, or using them in a format that's not approved by their provider. Over time, though, the brain adapts to these extremely high levels of dopamine in the body. One of the things it does is that it starts down-regulating the number of receptors that can take in that dopamine. When there's less receptors able to take in that dopamine, you need more and more of the drug to get the same high as you did before. But with fewer receptors and that drug not in the body, what starts to happen when you do everyday activities? You feel almost no pleasure hugging your kids, eating ice cream. And to feel that pleasure, you start seeking the drug more often. As people start to transition from pleasure being the primary motivator over towards more requirements to have opioid in the system to feel normal, we start seeing the more concerning behaviors associated with chronic addiction. And that can be things like homelessness, like stealing, like destroying family or friends in efforts to be able to access the drug. All of these are signs that the brain is now deregulating its ability to control the opioids. The brain shuts down the frontal cortex, a part of it that's responsible for saying yes, no to dangerous situations and providing executive function. It shuts down to part of the brain in the memory that allows you to remember things that were not necessarily positive when you used opioids the last time. And it upregulates parts of the brain that are responsible for anxiety and fear. You put this all into the central nervous system on a day-by-day basis, and what we see is that the brain starts to lose control over its own behavior, and the drugs are in control. The brain also remodels such that parts of the brain that would talk to other parts normally on dirt paths or bike paths start to become 4-lane freeways. And this allows the brain to over-regulate the parts of it that allow it to pursue the drug. Putting this all together, we see stages of addiction develop in a person, and to the friends and family, it can be very difficult to watch. But know that there is treatment and there is hope. A variety of medications are on the market and available for use, and when combined with biopsychosocial spiritual treatments, can offer a great chance at recovery for patients struggling with this condition. What if we are the generation that ends this opioid epidemic for good? Opioid-related overdose deaths are now the #1 cause of death in adults under age 45. Their influence has been so great, they're even reducing the American life expectancy. These trends have us fearing the worst, and as a result, we begin to view opioids as the enemy. The drugs that we've long trusted to help kill pain are now killing us, and with this, we fear what they'll take from us when we take them. But what if opioids aren't the enemy? What if our misunderstandings of them was? What if we truly took the time to understand pain and addiction from the perspective of those dealing with it? Would our stories have happier endings? You see, the opioid epidemic is always personal. I lost my own nephew, just 24 years old, after sustaining a head injury in a skiing accident, unable to live with the pain anymore and unable to navigate the medical system, to suicide. You see, the opioid epidemic is a story about all of us. It's about the people we love, the people we've lost, and the people we fear losing. Medical providers can't prescribe us out of the opioid crisis. Government agencies can't regulate us out of it. Drug treatment programs can't counsel us out of it. It is time that we start to fight the myths about opioids instead of the drugs themselves. What would the world look like if we were equipped with the information on how to use opioids wisely, store them safely, avoid their risks, and reverse their problems? It's time we turn our attention away from the battle against opioids and instead put our focus on the people who may truly benefit from their use. or those who are facing their consequences. What if we all work together? Hope is in sight, and this crisis is ours to end. This can be the generation to do it. That ending must include you.